Hi, this is Dr. Fox, licensed psychologist in the state of Texas, and an expert in the area of personality disorders. And in this video, I'm going to talk about attachment and relationships and how that relates to borderline personality disorder. And I'm outside, so it is a little noisy, but I'm holding my microphone really close. So hopefully you can hear me clearly and well. And let's get started. So, a lot of folks have written me and mentioned concerns that they have about relationships and difficulty feeling safe with those relationships, inside those relationships. And that got me thinking about the attachment patterns and styles that a lot of folks have. And particularly since a lot of the videos focus on narcissistic and borderline personality disorders, I thought in this video I would focus on borderline personality disorder and attachment and relationships. And then if you're interested, leave comments and we can do a narcissistic attachment style and relationship video as well, because I want to give you guys what you want. So let's get started, and don't forget, like, share, and subscribe. So there are 4 types of attachment styles. And what I want to do is I want to describe each of them, sort of what they're like in children, and then how they manifest in adults. And then we'll talk about how that plays out specifically. So the 4 types of attachment styles are secure, avoidant, anxious, and disorganized. And we develop our attachment styles in childhood. And this is usually manifested out of how our caregivers responded to us, how they related to us, as well as how we explored the world. So let's talk about secure attachment style first. So in children, this is usually based upon trust, and they can depend on their caregivers, and they feel sensitive, safe, and emotionally available. Those caregivers are sensitive, safe, and emotionally available. And this develops what's called a secure base. And with that secure base, they're able to explore, learn, and thrive in the world. So they build up autonomy. They build up this sort of belief in themselves that they can be efficacious. And if we look at that perspective in children, that as they develop, and then in teen years, they move into adults. And in adults, what we see is that this is that security. It's this comfort with warm, loving, close relationships. Now, it depends on the partner and allows the partner to depend on them. So it's this equal degree of dependency, but also it's important to be aware that even though, dependency waxes and wanes in relationships. So it's not always going to be 50-50. Sometimes it's 80-20, sometimes it's 40-60, whatever it may be, depending on what's going on in those relationships, what's going on in your life and in your partner's life too. So it's important to consider that, but that secure base as it manifests in the adult relationship and feeling warm, loving, close, in that relationship to someone else is part of that attachment security. Now, they can depend on their partner. Again, they feel comfortable doing that. They're not worried about rejection, and they're not threatened by their partner's separateness, meaning that they go off and they may hang out with friends or they may do things on their own, and it's not this fear of that individual leaving them. And this is something we often see in individuals with borderline personality disorder. It's a lot of that abandonment fears that they often have, that fear of rejection. So we see that it's not in that secure base, but knowing that secure base and that security can help us identify or focus on those things that we want to build in our relationships. And it is possible to change your attachment pattern. And we'll talk about that at the end as well. And what we see is these relationships with these secure individuals is that they're comfortable with themselves, they're comfortable in their relationships with others. Now, the insecure attachment types, there are 3. And as I mentioned, they're avoidant, anxious, and disorganized. Now let's talk about the avoidant. Now in children, this avoidant attachment pattern, this is the caregivers are distant, rejecting, they're emotionally unavailable. And it's a deactivated attachment behavior, which means that they deny the needs and avoid closeness with those children. And so the child does not develop trust and this degree of self-reliance because of this sense of uncertainty. So what the child learns, what the individual learns, is then they develop what's called a dismissive attachment style in adulthood. And this dismissive attachment style is that they're uncomfortable with closeness. They are distant and rejecting. As people get close, they kind of pull away. They avoid that closeness. This equates to intimacy as sort of a loss of independence. So they see relationships that they lose themselves inside them. We see that it does not depend on the partner, and partner can't depend on them. So there's this inconsistency, right? So that person is sometimes there, sometimes they're not, sometimes they follow through, sometimes they don't. And that's different than this sense of irresponsibility. What it is, it's this sense of a lack of connection and drive to connect to that person. So there's that avoidance or dismissing of the value of the other individual. And a lot of times in adulthood, that these avoidant or dismissive folks will often be seen as sort of cool, not like cool, like Fonzie cool, if you know who that is, but it's more like cool, sort of very flat, very cold, very controlled, and compulsively self-reliant. So there's a lot of fear related to being reliant on others because of the way that they grew up, and those caregivers were sort of avoidant. They didn't really connect to them very much. They weren't seen as high value. Now, the next type that we're going to talk about is disorganized. And this disorganized attachment style in children, and this is developed out of caregivers. They inflict severe maltreatment. There's no organized strategy to connect with the child. It's a lot of confused, frightening experiences. It's disoriented. This leads to instances of disassociation in many cases, and there's a controlling and punitive caregiver. So this caregiver is so demonstrative that they don't allow the individual or the child to develop this sense of autonomy, this sense of efficacy for themselves, where they can control their world as well as master their world. And what we see is in adults, they have this unresolved and disorganized attachment pattern. And in adults, they can't tolerate closeness. Past traumas intrude into current relationships. And so severe psychological problems in acting out is also very common. Maybe a low frustration tolerance. And you might be thinking, yeah, but that's in BPD as well. And it is. And I think that a lot of folks with BPD can have components of unresolved, disorganized attachment patterns. I absolutely believe that that's possible. A lot of them do come out of that disorganized childhood experience. So that's also very common. And what happens in adulthood is that they get into these relationships and they're often very chaotic and dysfunctional, which means that violence could be present. There could be substance abuse. So it's very important to recognize that there are some components here related to BPD. But in my professional opinion, and in studying attachment patterns as long as I have, actually since my undergraduate years, so I've been studying it for a minute, but I think that the anxious and preoccupied attachment pattern fits best. Now, these attachment patterns are not mutually exclusive, and we'll talk more about that after we discuss this next anxious attachment style. But I think that it fits best with borderline personality disorder. And what it is that anxious, so caregivers are inconsistent and anxious. They're very, it's like a hyperactive kind of attachment behavior, and they're very demanding, clingy, needy. They don't trust in the child that the child can function well themselves. And there's a lot of constant anxiety. Now, the response to anxiety can be very individualized, which is that the parent sometimes, when they experience a lot of anxiety, they may become punitive, they may become violent, they may become very loud in volume, they may be hypercritical. So the way that parent manifests or manages that anxiety while they're rearing and raising the child, I think is also an additional component. But what we see is this anxious attachment style. Now, in adulthood, what we see is this preoccupied, anxious attachment pattern in those with BPD. Now, that doesn't mean that all individuals with BPD have the same attachment pattern, and it doesn't mean that all individuals along the BPD spectrum will have a preoccupied and anxious attachment pattern, but I think that it is most likely. So let me describe for you here. This is that they are constantly worried about rejection and abandonment. They need continual reassurance that that individual is there, that that individual is not leaving them, that individual does not have negative thoughts about them or negative opinions of them, and they want to merge with their partner. They want to blend in together. So you see this drive for enmeshment, that they want to be absorbed into their partner, and they want their partner to absorb into them. So it's like they become these two sort of, I think of like jellos, right? So they're two two different jellos that kind of gel together. That's the idea. Now we know that that's unhealthy because there's this anxious and preoccupied drive to lose oneself into someone else, which they believe will then make them a whole self. And that drive creates this intense sense of anxiety, and this constant vigilance for loss and emptiness tends to come out of that. Now, they also tend to have this neediness and distress that scares away some partners, and that is those partners because of that that tendency, that just the intensity of that need to try to connect to the other. I think many partners feel like they can't handle it, that it becomes too much, so then they self-select out of that relationship, which then actually goes back to enforcing those fears of rejection, abandonment, and emptiness, which over time creates that BPD. Now, remember, in my other videos, I talk about how these maladaptive personality disorders, particularly borderline personality disorders that we're talking about here, but personality disorders are a maladaptive attempt to cope with their life and aspects and issues in their life. And I think attachment is a very central component of that. So with my clients, when I work with them, attachment is a huge factor. Is that, I want my clients to attach to me. I want my clients to feel safe with me so we can move closer to that secure attachment. But to do that, you find that it's this push against the boundaries. It's this push to, is it safe? Can I trust this person? Is this person going to abandon me? What you're telling me, is it just so that you can take advantage of me? Is it just so, whatever. And those are the whatevers are the particular components for each individual that drive that manifestation of BPD and the particular surface structure content that comes out of it. So it's important to realize that, but it is possible to change your attachment style. And I think through positive relationships, through relationships that have good boundaries, through that sense of you experiencing the ability to manage not only your thoughts, feelings, behaviors, but also the images that come into your mind and manage it well and manage your circumstances well, I think you realize that, hey, I don't need to rely on this maladaptive pattern. I can go after what I want, feel comfortable with what I want, and go after what I feel I deserve. And I think that a lot of folks, particularly in relationships along the borderline spectrum, feel like they need to be in a relationship. And if they're not, they have the sense of hollowness, hence emptiness. And being in these relationships can really cause a lot of problems because they're maladaptive relationships. They reinforce those BPD beliefs, behaviors, patterns, maladaptive patterns that reinforce their core content. Now, a lot of my videos, I talk about core content as well, and those underlying components that really sort of feed the surface structure, those behaviors, those beliefs, those feelings, and so on and so forth. And again, I think that you can address these issues. It's usually, there's a lot of workbooks out there. I have a workbook as well, but there are other workbooks out there too. If you don't want to use mine, that's fine. But there are a lot of good workbooks out there that you can learn how to control and master these things. But I think the attachment with a therapist or with someone else and working through that and challenging those maladaptive beliefs, recognizing that need to jello, right? Like that jello with someone else is part of a maladaptive pattern. And that in the end, I think that having that preoccupied attachment, even components of unresolved disorganized, because as I mentioned, they're not mutually exclusive. You can have components of many, but that having this and this need to gel with someone else, I think creates an intensive fear and this long-standing discomfort. But again, I think it is possible to get more of the secure attachment patterns, which is feeling, the sense of warm, loving closeness in relationships. And depending on your partner and allowing your partner to depend on you, I think, as well, and not worrying about rejection. And remember that if you're in this relationship and it doesn't work out, you'll find another one. It's okay, right? And that you'll be okay even being by yourself, and becoming comfortable with yourself is important as well. I hope that you've enjoyed this video. Please leave any comments. Again, please leave positive comments. I am trying to create an environment that is very positive for a lot of folks that are dealing with borderline personality disorder, as well as those in relationships with them as well. And I wish you all the best. Like, share, and subscribe. And thanks a lot. Have a good day. Bye-bye.